In this video, I'm going to walk you through the real differences between synthetic hormone replacement therapy and bioidentical hormones. Let's dive in. So first, let's start with the basics. What are bioidentical hormones? Bioidentical hormones are molecular identical to the hormones your body produces, like estradiol, progesterone, and testosterone. They're often made from plant-based sources like wild yam or soy and are compounded to match your personal hormone levels. That means your body recognizes and responds to them just like your own hormones. They bind to your receptors the way nature intended. They can be compounded into creams, troches, which you put under your tongue, oral capsules, patches, or even injectables based on your body's needs. They're often better tolerated with fewer side effects. Why does this matter? Because you're supporting your body through perimenopause or menopause, the goal isn't just to mask your symptoms, it's to restore the balance of your body. Bioidentical hormones can do that much more naturally. So then, what are synthetic hormones and what's the problem with them? They're the most common option recommended by your conventional provider. These include drugs like Premarin, which is conjugated estrogens from horse urine, Provera, which is a synthetic progestin, and then birth control pills in younger women with hormone issues. These compounds are not identical to your body's hormones, and your body knows it. They bind to hormone receptors, but the results are often like a flood of side effects, which include breast tenderness, weight gain, mood swings or anxiety, increased risk for blood clots and stroke. And here's the kicker. Many of the large studies that raise safety concerns about hormone replacement therapy, like the WHI study, were using synthetic forms, which just isn't the true case of what we typically do in integrative medicine. Bioidentical hormones weren't even part of the conversation in those study trials. The most underrated hormone is truly progesterone. If there's one hormone I see most misunderstood in this practice, it's progesterone. Not Provera, I'm talking about the bioidentical progesterone, micronized, plant-based, and soothing to the body. Most women I see are either estrogen dominant or depleted in progesterone due to stress, poor ovulation, or the transition into perimenopause. There's countless of numbers of women who take my Harmony Within program, and I would say 90% of them, they have progesterone depletion or estrogen is higher in their body based on their blood tests. So they often are in this higher estrogen state, which can lead to cancer if uncontrolled or progesterone isn't looked at in their hormone system. Low progesterone symptoms include irritability or anxiety, trouble falling asleep or staying asleep, shorter cycles or heavier periods, breast tenderness, feeling wired but tired. And guess what? Synthetic progesterone does not support GABA receptors in the brain the way real progesterone does. So I've had patients that go from feeling anxious, wired, and restless to finally feeling good and sleeping throughout the night just by restoring their progesterone levels. And again, it's really important for progesterone to go through that blood-brain barrier to exert its very calming effect on the brain. So if we're using synthetic progesterone, it just doesn't do it the same way. And ultimately, no matter what, hormone replacement or not, what we're trying to do is heal the body's environment so that it restores its production of these hormones on its own, and that we don't need to use synthetic or even bioidentical. That's our goal. But sometimes when we are living in a standard American world, sometimes we just need that bioidentical support to get us through to the next phase. So what are the lab tests that I recommend before starting hormone replacement therapy? This is one of the most crucial steps, and it's most often skipped. Before I put anyone on hormones, we do a full hormone checkup because symptoms can be deceiving without context. Here's what I typically test, at minimum: estradiol, progesterone, testosterone, DHEA sulfate, cortisol. Depending on what the woman is experiencing, I might just do a blood test before 10 a.m. or if we want to get more deeper, we will do a 4-point saliva test or a Dutch urine test. And then full thyroid panel. We're looking at your thyroid, TSH, free T3, free T4, reverse T3, and then the TPO and thyroglobulin antibodies. And then again, typically we're looking at the whole terrain. So I'm looking at vitamin D, iron and ferritin. We can look at some nutrient cofactors like zinc, selenium, and B12 because they help with hormone production. And all of this really helps personalize your care to avoid blindly treating you based on symptoms alone. Because let's be honest, a one-size-fits-all doesn't work for hormones or your health in general. Well, here's what the research says. Bioidentical progesterone, especially when paired with transdermal estrogen, has been shown to be safer for breast tissue in cardiovascular health than the synthetic versions. So typically, I use the Select Balance progesterone that's made from wild yam. I don't like using soy-based progesterone because, again, soy is a phytoestrogen, so it can block estrogen receptors and drive estrogen. So I don't want to do that in the body. So we're using wild yam-based products when we do bioidentical progesterone. In fact, studies show that natural progesterone may reduce the risk of breast cancer compared to synthetic progestins. Other benefits of bioidentical hormones include better protection against bone loss, improved mood and cognitive clarity, enhanced sleep and libido. But remember, delivery often matters too. So transdermal estrogen through the skin is safer on the liver and has less clotting factors than oral estrogen. But when I'm testing my women, I also am asking them their symptom checklist. Do they have vaginal dryness or labial shrinkage or pain in their vaginal area? Because then I'm going to give them estrogen directly into that area, which decreases their systemic uptake of the estrogen. When done correctly, BHRT is one of the most effective anti-aging, pro-energy, and life-enhancing therapies I can use with my patients. So how do I treat women with hormone imbalance in my clinic? When a woman comes in to me, they're feeling exhausted, foggy, gaining weight, or feeling disconnected from their body, I will work with them through this program called Harmony Within. We look at the whole picture, not just the hormones. We start off with comprehensive labs, nutrition and gut support, sleep optimization, blood sugar regulation, stress and adrenal testing, then hormone support if needed. For some women, BHRT is a key part of their healing, but it's always a part of the larger puzzle. We don't just throw estrogen or progesterone at symptoms or testosterone and hope for the best. You deserve to understand what's really going on in your body. Bioidentical hormones aren't just a natural alternative. They are often the safer, smarter, and more effective choice. Comment below if you've learned something new today or if you've had experiences, good or bad, with hormone therapy. I read every one. And please like this video if you want to see more content related to hormone balance, perimenopause, or how to support your cycle naturally. Please subscribe and hit the bell so that you don't miss the next video on Women's Health series. And if you want us personalized support, lab testing, please check out my programs. You can go to selectbalance.com, type in Women's Lab Panel, and you can see all of the lab tests that we run within Harmony Within. You don't have to suffer with hormone balance. There's a better way, and start understanding your options today. Have a great one. See you next time.